Advisory Committee to order. The first is roll call. I'm Tom Riley from Pioneer Center.
Kim Hankins from McHenry County College.
I'm Drew Dustin with MCDOT.
Jenny Hershey for continuing and promotes.
Doug Martin with the City of McHenry.
Nick Hammond, City of Crystal Lake.
Scott Hennings with the County DOT.
Kate Pearson, Mobility Outreach Coordinator for the region Lake McHenry, Northwest Cook, and North Shore for the RTA. And this is my first meeting, so it's great to meet all of you.
Welcome. Thanks.
Ed Gallagher, Pace Suburban Bus, Community Race Relations.
Gary Scott, Pace Suburban Bus, Senior Project Manager.
Shaylin Daigle, McHenry County Council of Governments. Kelly Schmidt, McHenry County Specialty Courts.
And that's everyone. And let's see, introductions we did. Minutes approval from the last meeting. I was here, so I can make a motion to approve these minutes. Need a second?
Second.
Okay. Those are approved. Is there any public comment yet? Or I don't think anyone signed up.
I don't think anybody signed up, but if anybody wants to make public comment, you're more than welcome to.
Okay. Then the old business, and I will hand this over to Scott, I think, correct.
Yeah, so bear with me. Jasmine's not here today, so I'm picking up. Yeah, should I move that chair out of the way? You can come up here, Shaylin, if you want. You're like peeking over the chair. It's hard to. So yeah, bear with me while I kind of go through this. Jasmine in the packet put in the ridership data for January, February, and March of this year. Not too much surprising. I mean, it's kind of standard, seeing about 7,500 trips a month on average. The last I checked, year over year, I think the last 12 months we're right at about 85,000 trips on the bus, and then another 500 or so on taxi over the last 12 months. So we're still well below 2019. I think we hit our 2018, 2019. We hit our max at about 105,000 trips, and since then.
Sorry, someone just popped in and said it's still in pre-meeting mode. Is there someone with us? Sorry.
No, sorry. Thank you.
You're welcome.
I guess we'll do video. There we go.
I don't know
Thanks.
who it was. I just saw it come pop
Yeah,
up.
I appreciate that. That's why we have backup options. So like I said, we're still below 2019 peaks in ridership. And I think part of that is because we've started, since August of last year, we started using this MC Ride Connect Uber subsidy program, which I think we're giving about 1,000 trips a month as of right now, and it's trending upwards. So that is taking some pressure off of the MC Ride bus program as some people switch from one to the other because it just makes more sense for them. So I'm not too alarmed with 85,000 trips over the last year because these other options are becoming more successful too. So I believe, let me go back to Jasmine's sheet here. Oh yeah, so these were origins, destinations, and this should all be in your packet too, so you should have all this information. And MCC, you can kind of see the progress on the MCC rides. Kim, I don't know if you've heard anything new about our partnership, but we're still providing trips for MCC students, which are then offset by MCC paying for the fare on those trips, so the students themselves get essentially a free ride to school.
Which is money that we had from the COVID grant, and it's going to run out really soon. So we're trying to figure out what to do.
Yeah, and I hope we can find a way to continue that into the future even without the COVID relief funds. And I think with that, I'm going to stop just because I don't know what else to say. But if there's any questions or if anybody else wants to add anything, now would be the time. Has anyone heard of any issues with MC Ride in the since we've met last, any issues that you've come across? Any issues at the city? You guys get calls at all? Or? no issues is good. That's a success for us.
Did you do the Ride Connect?
Yeah, MC Ride Connect, I don't know if we have anything in the I don't think we have anything in the packet that is regarding that, but like I said, we're at about 1,000 trips a month and trending upwards every single month. I think the last time I checked, Gary, maybe you have the data more than I do, we're over 150 unique individuals are signed up, registered, and actually riding the program. We've got some people that use it quite a lot, as in like 40, 50 times a month. We've got some people that use it once a month, right? It kind of varies dramatically in terms of the usage of the program. And just for those that don't remember, MC Ride Connect will fund up to $16 on your Uber or UServe ride after the rider pays the first $4. The county will then come in and pay for the next, up to the next 16.
But it's still for that small population.
Yeah, it's still just for people who are registered with the RTA that have a reduced fare or ride-free card or ADA paratransit certified. Which is actually quite a large amount of people are actually could qualify for this. It's not a small group, but we know a lot of the folks that maybe could qualify for those cards haven't gone through the process of getting registered, and that's where the RTA is going to be helpful to help get people signed up. And we, Jasmine and the RTA, have been working real hard over the last year to help make sure people that can get this card get signed up and then get registered with us for our program. But nothing but good, Gary, correct me if I'm wrong, nothing but good comments and input on how MC Ride Connect is working so far. I think actually we're scheduled to give a presentation to the RTA on MC Ride Connect coming up here, and because they're interested sort of how the program's operating for potentially expanding to other parts of the region as well in the future. So yeah, sorry I didn't have any more hard data to support it. I think I was, this isn't confirmed yet, but I think I'm going to be giving a presentation to the county board on the MC Ride Connect program, potentially with specialty courts at the June, I think we've decided on the June county board meeting. So if that happens, I'll make all of you aware so you can tune in and listen. All those are streamed just like this one is. And yeah, I'll have much more detailed information about how the program's working at that point. But overall, it's great to have options, and I think right now what we're seeing is that people are choosing whichever options works best for them, which is great.
Thank you. Now the service partner updates, the RTA update. Kate, will you be doing that?
Yep. So from the RTA, we have launched our Save Transit Now campaign that can be found at savetransitnow.org. It's a way for our constituents to contact their legislators to ask them to save transit now. That's gone out on English and Spanish, TV, radio stations, digital billboards, signage and social media. There's also, as of today, we released our Save ADA Paratransit Now campaign, and that can be found on our website, rtachicago.org/ADA Paratransit. I do have QR codes that I can pass around if interested. And then just my last update is the RTA will be adding an additional registration site in McHenry County. I will share that with all of you once it's live, but I can let you in on, it will be Door Township. That will be closer to the north of the Wisconsin border. So we want to reach more constituents and riders in McHenry County. So those are my updates. That's the RTA.
Is the current sites is the senior services to get?
Yes.
Is it-
We'll just be adding an additional one in McHenry County.
Okay.
Yep.
Thank you. And then the Pace Bus update, Ed and Gary?
Sure. I can start. So just on the paratransit side of things, I think everyone knows me. I'm Gary. I am the project manager for Henry County, Lake County, the regional Northern Mobility Management Call Center, and then DuPage and Kane, the Ride and Cane program. So our contractor, Transdev McHenry, and our taxis continue to have on-time percentage that is above 95%, and that includes 2 appointments. So service has been meeting our standards, and it's reflective in your comments that people have not been complaining. We have had complaints at minimum for the MC Ride program. We're continuing to hire at pace, which Ed might talk about more too. As well at our contractors, we're also hiring. We are still continuing to prevent sickness by sanitizing the vehicles on at least twice a week and making sure they're washed thoroughly inside and out. Beginning in December, we began to utilize user to provide additional capacity for the MC Ride program. And then also for the MC Ride Connect program, we just recently started using user as an additional TNC company under the program. So it's Uber and user, and riders can pick either or to take their trips with MC Ride Connect. Then beginning on April 15th, there's a new Ride Share Access program that rolled out in Hinsdale Lake Terrace with user and Uber. And that's basically all I've got. Come find me afterwards if you have any questions, or do you guys have any questions or comments?
And not any questions, but while Gary was talking, I pulled up some of our MC Ride Connect data that I didn't have during my update. So it kind of confirms what I had talked about earlier. So Gary sort of introduced some of this, but you can see, so we have data from August of 24 through February of 2025. Zoom out here. And actually Jasmine did provide these. That's what this sheet is. If nobody, so you guys didn't grab this on the way in. There's some sheets here with this information. What's cool is that we track, so on the top here, we have trips and cost, right? So we started out very slow with the first month, 280 trips, about $3,500 in subsidy. But fast forward to this most recent month that we have, we provided 1,400 trips in February of 2025 at a cost of about $18,000 in subsidy. So you can see the growth over time. It's slow and steady, but we expect that as more people get registered, this is even going to go higher than it is today.
It's 98 users, is that what the 98?
Yeah, these are unique people, right? Because I mentioned some people ride a lot, some people ride a little, but in the given month, that's how many people we have using it. So I would expect, this is in February, we had 98 people. I bet you in April, we probably had well over 100, probably 150 at this point, that are using this program currently today. We also are tracking the distance, duration. Every trip, Uber charges an admin fee of $1.50 per trip. So you can see that over time, we've spent just about $9,400 just in administration fees for Uber and Lyft. That's just for them to process the program.
Uber and user.
Uber and user, thank you. And then what's really interesting for us is that the cost per trip figures are so low, right? So we'll pay up to $16 per trip, but on average, what we're seeing is right around this $11, $12 a trip figure is how much we're actually subsidizing on an average basis. And you compare that to the MC Ride program where the subsidy is closer to $40 a trip, 12 versus 40, huge difference. And so that's why we are optimistic that this could actually save money in the long term, right? As more people kind of find this as a beneficial option. So that's pretty much it. And again, we budgeted $420,000 this fiscal year. We're not going to spend anywhere near that. We're probably going to end up somewhere in the $250,000 number range in terms of total subsidy for this program in 2025. But because it's so successful, we'll continue to build this into our budget moving forward into 2026. And I'll mention to this group, we applied for RTA Section 5310 funds for this program starting next year. So essentially what that means is that all of the people that use this program are eligible to receive reimbursement for their cost through the RTA Section 5310 program, which pays for 50% of trip cost for people with disabilities or senior citizens. So theoretically, if the RTA funds us, which I suspect they will, we could get half of what you see here reimbursed to the county after the fact. So it actually would cut the county's cost in half, allowing us to do more with our local dollars going forward. We've been getting RTA money, federal money through the RTA for our bus program for a decade now, so this is a very common grant that we've gotten for many years, but this will be the first time we're going to apply it to something new like the MC Ride Connect program. And on that topic, we're also, to help us kind of administer this the bus program, the Connect program, and the other type of transit things that we're doing, we're actually going to be hiring a new staff person that's going to be in charge of grant administration. With this grant and others, they're going to specialize and kind of make sure that we're being timely with our reimbursements and things like that. Some people call him a mobility manager. We're just going to have him sort of as like an accounting position, but hopefully we'll get somebody hired sometime this spring or summer to kind of take over that from us going forward. So lots happening on the transit front at the DOT right now. So sorry to jump in to the PACE update, but
No, you're fine.
overall, make sure you guys all
Good updates. I have a further update. So Ed Gallagher, Pace Suburban Bus. I did submit a full written report. I'm going to read a couple of the things. I won't read all 3 pages, but first, from a ridership standpoint, for the entirety of 2024, Pace saw 20% ridership growth compared to the previous year of 2023. All 3 of our service boards have seen 3 consecutive years of double-digit ridership gains, year over year over year over year, which is really great. Glad to see, and we're happy to see that our continued investments are bringing back our riders. January of 25, Pace continued that growth. We carried just under 1.8 million riders for a 12.1% increase over January 2024. Our ADA paratransit trips in January were up over 47% compared to the 2024 numbers, carrying just under 22,000 riders per average weekday. This could not have been done without our TAP and our RAP programs, so our Taxi Access program and our Rideshare Access program. February 2025, we carried 1.7 million riders. The agency was carrying at 70% of pre-pandemic levels there in February. March 2025, Pace carried 1.9 million riders, which was a 5.4% increase versus 2024 levels, so continue to see that come back. And then 2025 riderships do continue to reflect that Pace's investment in frequency and targeted system enhancements are bringing more riders back into our system. We will continue to build on these enhancements through our system-wide network restructuring program revision, which I've presented on to this board in the past, and our staff is currently working on right now. Glad to report we have an update on the regional day pass. At our April board meeting, Pace's board of directors approved a key step forward in expanding and improving regional transit access for riders across the Chicagoland area. The board authorized the first amendment to the Intergovernmental Agreement, an IGA, for the Regional Day Pass, which is known as RDP, pilot program, a collaborative effort between all of our transit agencies, Pace, CTA, Metra, and the Regional Transportation Authority. The RPD will provide riders with a convenient, cost-effective option for unlimited rides on all 3 of our single systems for a single day, on all 3 of our systems for a single day. It's also going to come in at a lower purchasing price than if you were to buy a single day pass from each agency. This amendment reflects an update to the program's business rules, fare structure, and reimbursement processes to implement, to streamline the implementation of that program. I provided a screen grab in the report that has the current projected cost structure So you can compare what it is today to get the single day pass or a single ride passes, and then you can compare that to see what the regional day pass pilot program will be. Key update, there will be a reduced fare for the regional day pass. So individuals who do sign up and you get certified for the reduced fare, the free fare, or the ADA fare will see a reduction. Free fare, you'll obviously have the free rides, but the reduced fare and the ADA reduced fare rides can get that half price fare. So you'll see there is a reduced cost. Apologize, it's a little bit small to read on this, but once it's fully published to the public, it'll be available on Ventra as well as the Pace Plus website. Yes?
So I'm reading this right, and I just make sure you can confirm this. So we're out here in zone 4, right?
Yes.
And so theoretically, if anybody out here wanted to go into the city and purchase this regional day pass, it would cost us $16
Yes.
for basically unlimited transit throughout the region for an entire day.
Yes.
That's a really good deal because the Metro fare alone is, I forget how much it's at day
It's
pass.
$13.50.
$13.50.
It's on the upper part.
There you go. So it almost begs the question, like, yeah, why wouldn't people take advantage of this going forward? It's
Yeah.
exciting.
Well, and that's when you were to look at it, it's almost a $2.50
Yeah.
savings to get the combined pass versus if you were to buy a Metro pass and then a Pace CTA pass. So if you were to truly travel on all three of the systems today versus what you can get with the regional day pass, you'd save $2.50.
And how does that work with, like, I know the fare media on Metro is different than on CTA and Pace in terms of the use of your Venture card versus an app. Maybe you already said this, but how does that work as far as?
This will be available through the Ventra app and the Ventra system.
Cool.
So you'll buy that through the Ventra system.
Just market it to all the people that go to Cubs games from here.
Yeah.
You know?
Yeah.
Or museum, like go to the
Yeah.
museum, take the train down, take CTA, it's awesome.
Yeah, so you just buy the one pass and you can make any transfer you need, and it'll get you home as well. So, really great. And then we will be releasing that later this spring. So I don't have an official date yet, but once it's live, I'll share it with Jasmine and Scott so it can go out to the entire board so that you guys will know. And then the last two items I want to mention first are the fiscal impacts. So as requested by the Regional Transportation Authority in January, Pace provided a reduction in service scenario at the March RTA board meeting. This scenario could be implemented starting in 2026 without additional funding to close the fiscal cliff. System-wide, all weekend fixed routes and on-demand services would be eliminated. 62 of Pace's fixed bus routes would see operation reductions and cuts to late-night services beyond 8 p.m. Additionally, 42 fixed routes would have frequencies further decreased to being available either once an hour or twice per hour. In line with these fixed route reductions, ADA services would also see a reduction, as losing weekend services on fixed routes, you would then lose the opportunity for ADA service because they are connected. So the 2/3 of the weekend services would be lost on ADA service. All new service enhancements such as pulse expansions and the transformative system-wide restructuring project that we are currently working on revision would have to be placed on hold. Pace continues to work with our area legislators, stakeholders, and all partners in labor to find solutions to closing this transit fiscal cliff. I know our staffs are all working together on that one to prevent that sort of an outcome. But I wanted to update everybody on that presentation that was given to the RTA board meeting in March.
I know you probably don't have the answer to this, but I'm
Yeah.
going to ask you anyways. There's a lot of talk about cuts to fixed route service if this fiscal cliff, if we were to go over the fiscal cliff. Was there any discussion at the board level or that you've heard of cutting the other types of services that you offer throughout the region, like the MC Ride program, right? We're getting about $2 million a year from Pace right now. I'm concerned that cuts to that program would actually have more of an impact for McHenry County than cuts to the fixed route services, right? Has that been talked about, or are you privy to any of those conversations around cuts?
I am not privy to those conversations, but I'll just say that I think every sort of expenditure would probably be up for review. So I don't think anything is officially off the table. So
For what
we
it's,
would see that.
yeah, for what it's worth, and the committee should know this, right? I think the county, we are doing some preliminary analysis to figure out what PACE, if PACE were to cut back on their contributions for the dial-a-ride program, what that would mean for its future. Whether the county would pick up the slack, or whether we would divest ourselves from this program as well, right? Because the way the program is structured today, it's a 50-50 split. PACE pays 50%, the county pays 50%. If PACE cuts back on their contribution, by the agreement, we need to cut back on ours, which then shrinks the program, which means people get denied service, people can't get a ride, maybe we only operate 5 days a week, maybe we cut back on night hours. I mean, the ball starts rolling, and where it stops, we're trying to figure out what that is gonna look like if we go over the fiscal cliff. I hope it doesn't happen, but I think we owe it to everybody to tell you we are looking at different scenarios if that were to come to pass.
I got a question for you,
Yes.
real quick. Probably a silly question, and as I'm saying it out loud here, but looking at the 770 million figure, in that scenario that you presented to the RTA board, was that looking at a complete reduction for pace of 770? Because my understanding is 770 is the
Right,
full
that's the
cover.
system-wide.
So you're looking at just your share of whatever that reduction would be in,
Okay.
correct? Thank you.
Yeah, and I don't remember the total off the top of my head,
That's okay.
but yes, we are just looking at our piece of that 770. And then the last two updates, I'll just give a quick high level. PACE's board came out to McHenry County to have a ceremony with U.S. Congressman Bill Foster on the presentation of his $1 million award for community project funding for PACE to purchase up to 5 electric ADA paratransit vehicles. So we were glad to have our board members come up and celebrate that occasion. I know we're working with our federal partners to move forward with accessing and moving forward on those funds. When I have more details as to when we might be able to see those vehicles on the road, I will let you guys know.
Is there one now, is there a electric PACE?
We
bus?
do have officially one paratransit electric ADA paratransit vehicle, and then we have 2 full fixed bus route electric
In
vehicles.
McHenry County.
Neither one of them are active in
Because I
McHenry
swear I
County.
saw one the other day and I almost caused an accident because I was trying to figure it out.
So our ADA, yeah, so they drove it out for the presentation, so there was a nice photo op. We brought out the electric paratransit vehicle. But it's currently in testing. The ADA paratransit electric vehicle is currently in testing, and it would be used on ADA paratransit services out of the River Garage in Elgin. So there is a chance you could see it in operation up this way in the near future, but as right now, it's still in testing.
And you just broke ground on your new all-electric facility, right?
Yes, we did.
Yeah, it's pretty
Yes,
exciting
yeah,
as
we
well.
broke ground on our foundational project in Waukegan for the advancement of that bus garage in downtown Waukegan. And it's a 2-phase project where we'll be building an external charging station outside of the facility. Before then, we expand the full facility's capacity and upgrade, everything that goes into it so it can manage a battery electric fleet. And then the other 2 projects after North in Waukegan will be Elgin and then Southwest Garage in Bridgeview. I believe it's Bridgeview or Bridgeport. But yeah, so it's Southwest Garage and then River Division. And we're already in, I believe, conceptual design on the River Division right now for that expansion, so.
So the commitment PACE has to electrification hasn't waned over the last year or so.
No,
Right,
we're still moving forward. We're still on target for our 2040 commitment of our Project Zero. We're continuing to work with our funding partners to find new avenues to fund these expansions. And then we did receive new grant funding recently, and we've purchased 33 battery electric hybrid buses that will be distributed throughout the region once they start to arrive. And then we just placed another order as well, I believe upwards of 70 vehicles, battery electric hybrid, that we've purchased over the last year and a half to expand our opportunities. The battery electric hybrid are helpful because we don't have to fully transition the garage to do all the charging as we would for a full battery electric. So we can get a hybrid vehicle out there and then control when it uses its electric battery, so we can have it geofenced to turn specifically to full electric when it's driving through certain areas as we see fit, as we want to improve air quality in our communities. So battery electric hybrid is going to be a good, helpful stepping stone as we move towards a full zero emissions fleet by 2040. Great questions, guys. And then the last one, I'll just leave you, there's an update on the revision project, so we're continuing to move forward with the planning for expansion, and we should have the draft plan released come October is the plan. So we're currently actively working on pulling together the comments that we received from our community members, our stakeholders, and our riders to generate the draft plan, and we'll have that out hopefully, end of summer, late fall, or late end of summer, beginning of fall.
And I know you guys presented to the board of directors too. Did you get any feedback from them on whether more of a coverage model or a ridership model was more preferable to the PACE board of directors, or?
Yes, yeah. Our board gave the preference is to shift slightly towards a coverage model versus a ridership model. I don't remember the official statistic that was stated, but there was a slight lean towards coverage and getting more vehicles into communities that maybe don't have service today. So we're continuing to work with the board, with our contractors to take the board's recommendations into account, and we'll have that draft plan out in the near future.
And that's important for us because I think under the coverage model, I think we had 2 or 3 new bus routes in McHenry County alone. So even if we were to just get one of those, if they're not going all in on the coverage model, but maybe tiptoeing in that direction, we could actually see another bus route in the future come to McHenry County, which would be spectacular. Because it's been over a decade since we've had a new bus route implemented, which was the Randall 515 route. So yeah, thanks Ed. You're welcome. Great update. Thanks guys.
That's good news, yeah.
I don't think there's a Metro update today, but Kelly, I don't know, not to put you on the spot. Do you want to update the group on how your ride to recovery is working or operating? And if you don't want to, you don't have to.
No, that's fine. I can look at the numbers before I came, but Scott and I have been talking about eliminating the specialty port bus because our clients are able to utilize Ride Connect, MC Ride Connect, which has been working very well. I am appreciative of everybody who supported trying the bus. I think it was just too much area to cover with one bus, and I tried to get additional funding from different sources to add a route to see if that would help. But with the MC Ride Connect, I don't think we really need it any longer. So we talked about phasing it out. I'm very sad because that was like one of the first things that I did when I became director. But I just appreciate that all of you listen to the needs of the county, and that is really what matters. So I'm just very thankful.
Yeah, I think it was this group that sort of gave the Ride to Recovery some momentum and sort of got the conversation going. And again, I subscribe to the view that let's try something and see how it works, and if there's a better mousetrap, we'll use that instead. And I think at that time, MC Ride Connect was more of just a thought. It wasn't actually in place yet, and now we're seeing that MC Ride Connect can probably do the same thing, maybe for a little less money, and it's probably going to actually be a more user-friendly service too than the Ride to Recovery as well. So Kelly and I are working together on transitioning towards that, and probably 2 or 3 months we'll probably move in that direction over the next couple of months. Thank you, Doug.
Now we're on to new business, and back to Scott, I think. MC Ride Connect.
Yeah.
Program eligibility.
The March Transportation Committee meeting, which was after this group had met last time, we proposed, so we got a letter from the public health administrator for the county. Basically, another county department asked us to consider adding WIC clients, which is the, maybe somebody else can explain it.
Accompanied to appointments.
Well, yeah, so essentially, yeah, women that are either just gave birth or about to give birth are WIC eligible, right? And they were asking whether or not those clients could be eligible for the MC Ride Connect program. Because they're not disabled, they're not a senior, so currently today, they're not eligible for this program. But we know there's a need out there for women to get to health appointments, as Tom was saying, to even after they've given birth, to make sure that they get adequate things for caring for their child, And so we brought that letter to the committee, and the health department was out here and made the case for why we should add them to the MC Ride Connect program. And our committee directed us to work with the health department to make that happen. So we don't necessarily have a timeline in place yet about when that's going to occur. But sometime this year, I'll say that, we're going to start adding another clientele to the MC Ride Connect program. And it's obviously a much smaller group of people than the existing program is today. But it'll be our first foray into adding people who aren't disabled, but not seniors, into the program to see how that works. So yeah, I just wanted to make sure this group was aware. If I have more information next time, I'll share it at that point. And we'll try to make sure we break out going forward how many trips we're seeing from that group versus the existing group that we have today.
How is that? Well, I guess we'll get to that in future meetings. I'm just wondering how you're going to get to those people so they know that that's a possibility.
Well, we're going to be working, so the health department is going to be doing the bulk of the work,
Okay.
right? So it was their idea. They came to us to ask if this is a possibility. And so we told them that if the county greenlights this, we don't have the staff to do exactly what you just said. The health department does, and that's what they do. They've got programs that work with these clients every day, and so they would just be sort of folding this into what they already do with clients as an option. So they would be the ones to educate them that this exists, register them for the program, probably help us track the usage. So we're really going to rely on, and the nice thing is they're another county department, so it's not like I'm dealing with the city of Crystal Lake, or they're sort of built into our organizational structure here, and so it should be pretty easy to coordinate with them going forward. But I'll say this, if that works, if adding WIC clients is successful and we think that's a great model, maybe we can start adding additional clients after that, right? Whoever that might be.
To qualify for a WIC card or whatever, it's income-based, correct?
You have to be, yes, you have to be under a certain income. I should have been more prepared for that question, but yes, it is income-based.
I'm asking because I think when we talked about it
Yeah.
before, we talked about income-based.
And I missed that, I missed that meeting when you guys discussed whether adding low-income folks to the
Yeah.
program was a good idea. There is an income criteria, and so, again, the nice thing is health department will help us verify all that kind of stuff.
And then, I mean, there are other, I don't know, entitlement or programs that are income-based. So
Yeah.
you could, if the WIC client adding works out, then you think that you'd have a model how to
Exactly, yes.
add more.
Yeah. Or if we find it's too expensive and we need that, we might dial it back. This is all kind of dependent upon the usage, right? We're capped at $420,000 a year. I mentioned in the first update that we're probably going to spend between $200 and $250. If the WIC clients double the program cost, we're going to run out of money, and then we're going to have to start thinking about maybe cutting back a little bit. We'll deal with that when we get there.
And then, is there fare card updates?
Yeah, I don't know how much Jasmine shared with this group previously, but we are going to be transitioning away from using MC Ride fare cards at the end of this year. So for those that don't remember, Doug, you've been here the longest, you and Tom have been here the longest, but back probably in 2012, 2013, this group, the PTAC group, told the DOT that you wanted a way for us to provide free rides to certain people, right? People that need assistance. And because at the time, the only way, it was a cash-based system. The only way you could pay for your ride was cash. And some agencies, like Pioneer or whoever, didn't want to hand a client a $10 bill and say, go get a ride, because you don't necessarily know that that's how it's going to be used. It's hard to track, that kind of thing. So instead of handing a client cash, they wanted some kind of fare media to hand to the client so they could get a free ride. And at the time, 12 years ago, we came up with this system whereby we would print these, we would go to a print shop and print out thousands of these like business card size fare cards. And we would then sell those fare cards to nonprofits and government agencies that we could hand them out to clients. And it's worked okay, I'll say. I mean, I guess for what it was supposed to do, it's done its job. It's allowed us to give free rides, but it's a lot of administrative work to not only on a regular basis print these, but distribute them, we take payment here at the DOT. So, we're not necessarily an agency that has a lot of walk-in traffic, that we're selling a lot of things, but this is one thing that people come in and they purchase these with cash or credit or whatever. So it's just a lot of work on the back end that people don't necessarily see. And so we're going to be sort of phasing that out after this year. I know we just placed a big order to buy more of these fare cards so that we could do one last sale. And people can stock up with as many as they want. And then starting, I think, on January 1st of 2026, we're not going to be selling these going forward. The idea is now, and what didn't exist 10 years ago was the use of Ventra on MC Ride as a payment option. It was only cash. Gary, how long ago was Ventra introduced to MC Ride? Was that last year or 2 years ago?
I think in June of 2024.
Okay.
Yeah.
So recently, Pace started allowing the use of Ventra on the Dial Ride program. And that has sort of opened up other ways for agencies to help clients get rides on our program. And so we're going to be encouraging, incentivizing people to use that as a substitute for this fare card system that existed.
And hasn't that existed that with Pace, with those cards? I thought Pioneer had one years ago, a terminal there that they could add the funding and, give clients cards.
Yes,
Yeah.
yes. Ventra, they allow nonprofit entities to become servicers. So you can get a terminal, for lack of a better term, that you guys would manage, and then you could sell the media. So you could take cash from your agent, from your client, and then load it onto their card.
Or not.
Yeah, or you could cover that cost.
Yeah.
Right? Yes, that would allow the nonprofit you would have to set up your own billing system. But again, the nonprofit could be the one paying to refill those Ventra cards. Yes, and it is still a program run through Ventra.
Okay. I'm not sure if it's Pioneer's using it.
I don't know.
It's in the closet.
But if there is an entity that's interested in that, we can help you connect with Ventra to have those deeper conversations about what the administrative burden is, what technology you might need to take on.
We might be interested in being a vendor too.
Okay.
I don't know if government agencies can be. I don't see why not. But yeah, it might be, since we're used to selling these cards here out of this building, maybe we could just have a Ventra system here to at least sell the cards.
They're definitely helpful. I'm sorry.
No, I was just saying maybe MCC too.
MCC as well.
Yeah.
Yeah, we do work with community colleges. I know a few other community colleges are servicers.
It's not free rides, right?
Yeah.
So, I mean, they're rides subsidized by agencies, et cetera.
Right.
So
Right.
I just, I
Yeah.
don't know, is it giving free ride cards?
No. Yes.
People will be showing up tomorrow.
Just for my own education,
Yeah.
Ted, once money is loaded onto your Ventra card, it can be spent on just transit, or can you use that money that's loaded on your Ventra card for other purposes? Does that make sense? Like, could I go to CVS and buy a gallon of milk with that Ventra card?
Yeah, to my knowledge, no.
Okay.
I believe it is only usable on transit, so you have to buy, some sort of fare media
Yeah.
through the app or use the tap card.
Okay. I know back when Ventra was first rolled out,
You're
how
right.
long ago it was, you could
Yeah.
use, maybe it wasn't a Ventra card, maybe I think they had an option to have like a debit card that acted as your Ventra card
Yeah.
somewhat, right, but it was also a MasterCard. And so I'm just thinking ahead for some of the agencies here, like, they want to prevent the use of what should be transit funding used on other purposes, so I want to make sure there's no way that could be.
Oh, I can find out. So that I
Yeah.
do recall seeing some historic Ventra kind of marketing materials that did show what
Yeah.
looks like a debit card type of thing. So I'll double check
Okay.
and find out if it's true that's no longer available to do that, right, to ensure that the money placed on a Ventra card is for transit. So I'll find out the answer to that question.
Okay. And again, this whole fare card thing was just to provide free rides, right? But keep in mind, these rides are super cheap to begin with, right? The $2, $3 fare that we're charging is 5% of the cost of that ride. So there's already a 95% subsidy. We were just trying to find a solution for that last 5% to get it to be 100% subsidy. But it's not like we're kicking people out or not letting them get a ride. These are continuing to be very affordable rides for people, even if they have to pay the full fare. Right? So, just wanted to mention that.
I have nothing left on my agenda, so
I just wanted, we can open it up for discussion, whatever, but I wanted to mention before the end of the meeting, Drew was promoted to our transportation planning manager as of last week. So he will be stepping into the role that I used to have before I was promoted and kind of overseeing the transit as well as other planning duties here at the DOT. So he'll be, you're going to see more of Drew at these meetings because he's going to kind of have an oversight of transit among other things. But Drew, for those that don't know, he was the planning liaison, doing a lot of work at CMAP and with our local municipalities, but now he'll be transitioning to this higher level role here at the DOT. So just wanted to mention that.
Congratulations.
Any other discussion items people have on their mind or want to chat about while we have some time?
I'll jump off you real quick if that's all right. Got contact information if anyone wants it. Title's wrong, but everything else is right on there, so.
I thank you from Pioneer. I guess Scott suggested that we apply to be on the Regional Mobility Committee also. So Pioneer submitted an application and two staff it was accepted, we'll be attending those meetings, so.
That's a CMAP committee, right?
Correct.
Yeah, so Chicago Metropolitan Agency for Planning has this group. And I'm not even sure exactly what the group is going to be charged with, but in any case, I'm glad Pioneer is part of it.
So am I, and it's not me. It's actually we now have a fleet coordinator because Pioneer has about 20 paratransit vehicles, 30 something overall. And she's one of the members, and then the other one, the community inclusion program kind of manager. So she's working with all kinds of clients, and it's getting them out in the community, which means getting transportation. So I'm looking forward to having them get more involved.
Do you think Pioneer, whoever that person is, could give regular updates of this committee potentially on how that work is going? Like having some cross.
If we figure out a way to
maybe
tell them it's required.
Or maybe you could do a mouthpiece of how that coordination is going.
Yeah. I will check that.
Because I think it's good to have the regional perspective. And for too long, CMAP hasn't really dabbled in a lot of the paratransit type work that this committee is so focused on. They focus more on the big, flashy rail extensions and fixed route, that's the stuff that the region is more focused on. I think the group that Tom's going to be a part of is specifically for people with disabilities and, folks that need a little extra assistance, how can we improve transit in the region going forward. And that's really what this group, I think, kind of talks a lot about too. So it'd be good to sort of have that perspective going forward.
And then also, I know very little about this too, but Pioneer's also getting some of the PACE vehicles,
Yes,
Please,
yeah, so PACE,
please tell me
you
about
have officially joined our community vehicle program that we allow for nonprofits to opt into. I believe you went with the Advantage program, which is for individuals with developmental disabilities. So they'll be getting vehicles from PACE to provide transit services to your clients and to the general public. You'll be managing your own vehicles from PACE. So I know your staff is going through the driver training, I believe, potentially this weekend.
I think they might have completed it. There was I think 4 of them have either completed or.
I knew it was coming up
Yeah.
here at the end of April, beginning of May. So I knew it was essentially either this week or early last week. So yeah,
So
good. Yeah, so you've entered that program, which is an accessible program. So Community Vehicle Program is the name of these programs. Under that, we have municipal, we have nonprofit shuttle, we have the Advantage van for agencies that assist individuals with disabilities, and then we also have our employer shuttles. So the bulk of these programs are focused on individuals, assisting individuals with work, but municipal vehicles have a little bit more flexibility. So our townships and our local municipal governments have a little bit more of a flexibility under the municipal vehicle program. But for the most part, they're focused on helping get people to and from work locations. And yeah, so if you want to learn more about it, just ask me, or you can take a look at Pace Bus website and search community vehicle.
Thank you, Ed.
You're welcome.
So we're doing that.
Awesome. Glad to hear you guys.
Yeah, so am I.
Interesting to see how it goes for you, you know?
Yeah, so am I. It was a process.
Yes, it is an application process.
Yeah.
It does take a couple of months. Some agencies, it takes a year to go through the application process. And then there is a driver training process element to it. So you have to designate a staff member to oversee the program, and then designate staff members who would then be drivers. It's up to the agencies to manage how that happens. Sometimes they have volunteers, sometimes they have employees that they can have duties as assigned. But some agencies, have other staff members who go through the training as well. So it does take effort, and it is a process. So if you are interested, we can set up a meeting to meet offline and go through that full process.
Anyone else?
Shaylin, you look like you got something to say.
No.
You sure? Cool. I guess we can end it a little sooner.
Motion to adjourn?
So moved. Second.
Okay, we're adjourned. See you in August?
Good question.
Right.
I gotta put it on the calendar, but.
So yeah, thanks for that.